Welcome back to Paramec Financial, and this is Jonathan Tran on Finance in 5 to 10 minutes. Today we're going to talk about healthcare terminology. When you're buying your healthcare insurance, sometimes there's some terminology, in the healthcare on how to use it that may be a little bit confusing, or you think you understand, but you're not quite sure. So today I'm just going to take some of the primary ones you usually see and just break it down for you, so that way, the next time you look at it, you'll have a better understanding of what it means. The first thing we always hear about is deductible, right? What is a deductible? A deductible is money that you must pay first before the insurance company either cost shares with you or pays their portion, right? So say, for example, if your deductible is $8,000, then the first $8,000 of healthcare costs that you incurred during the year, you're going to pay that 100%. And then we move into something called a out-of-pocket maximum. An out-of-pocket maximum, or OOP, means that this is the total amount of money that you have to pay out of your pocket the entire year before the insurance company pays anything. So those are the two main numbers that we have to worry about. One is deductible, two is out-of-pocket maximum. Now, some people may say, well, it sounds like the same thing. Well, it's not, because it depends on how it's structured. Now, sometimes you may pick a plan where you have a $8,000 deductible, for example, and then you have a $8,000 out-of-pocket. Well, in that case, when the two numbers are the same, then basically $8,000 is what you need to pay before the insurance company pays 100% for you. Okay, does that make sense? Now, the second way is sometimes you pick a plan where the deductible is only, say, $4,000, but your out-of-pocket maximum is still $8,000. So then how does it work then? So the deductible, remember, is money that you pay out of pocket first. So that $4,000 you're going to pay first, 100%. And then when you get to $4,001, you're going to cost share with the insurance company, maybe 20%, 30%, depending on the services rendered, all the way up to $8,000. So say, for example, it was a $1,000 bill, maybe you only pay $200, right? And that $200 gets added to your, now it's $4,200 towards your $8,000. So once you hit the $8,000, then you don't need to pay anymore, right? So that's kind of like clearing it up a little bit between deductibles versus out-of-pocket maximum, and then co-insurance. So that percentage that I was mentioning for you earlier, like say, for example, you are cost sharing with the insurance company, the bill is $1,000, but for some reason they only send it for you a bill for $200, and then the insurance company pays $800. Well, that's what you call co-insurance, right? There's cost sharing between you and the insurance company. Now, another thing that we may see is co-pays. Co-pays is a flat fee that we have to pay when we have to go see a doctor, for example, a specialist doctor, or when you go to the emergency room. Co-pays is something that you pay, every single time, regardless whether you hit your deductible or out of pocket, right? That's just something that you pay to get your services started. And then after that, if there's any services that are rendered, then it falls into your deductible and out of pockets. Some things you may see is inpatient versus outpatient, right? Just think about when you have in, the word in, you just in the hospital, right? You go to the hospital as inpatient. If you have outpatient, means that you're going to the doctor's office or a clinic or a specialty clinic to render services that are outside the hospital. So inpatient versus outpatient, just think of a simple way as in hospital, out of the hospital. So those are some terminologies that you may hear when it comes to healthcare. And so those are just some things I want to explain. Sometimes you may see RX, which is pharmacy, right? And you may see things like generic, preferred generic, brand name, non-preferred brand name, specialty medication. Those are just terminologies to let you know like what kind of medication you're taking, right? Of course, the generics are always going to be the cheaper choice, and then you move to the brand name, it's going to be more expensive, and then if you have specialty medication, it's going to be a certain cost. And so when you're looking at your healthcare policy, there's going to be a section about the drug coverage, and so that's what that's talking about. So in a nutshell, those are some things that you may look at a healthcare policy and you may wonder, ooh, what do all these things mean? Well, those are the general things that you really need to be concerned about. And then, if you have certain conditions, certain special things that you need, then of course you always want to call the insurance company to make sure that, hey, I need to do this. Is this covered? And, those things are on a case-by-case scenario, right? But in terms of how to understand some of the terminologies on your healthcare, these are the things that you usually will see. Right, so just make sure if you want to learn more information, follow our link below, and thanks so much.